Welcome. I'm Victor Zhao, the president of the U.S. National Academy of Medicine. You know, we launched the Healthy Longevity Global Competition nearly 2 years ago, in October 2019, and so much has transpired since that time. The purpose of this session is to provide you with a brief background on why healthy longevity is so important and how the NAM established its inaugural Global Grand Challenge on this topic. Once I set the stage and the context and explain what we've accomplished so far, I would like to invite my colleagues, the leaders and principals from the NAM's global collaborator organizations, to join me in the discussion. So let's jump right in. Can I have the first slide, please? As you all know, aging is a grand challenge itself. I'm not sure whether the slides are on. Can you tell me if the slides are on? Because I can't see that on the screen.
Not on my screen.
Yes, Dr. Zhao, they are live to the public. Feel free to continue.
Okay, good. So this is a really significant issue, one of the defining challenges of the 21st century. Living longer is now a reality, and our challenge is therefore to live healthier and stay healthier longer. To do so, if we succeed, we'll improve millions of lives and help us have healthier, more productive population of adults as they get older in the coming decades. So healthy longevity is a clear area in need of leadership, science, and innovation. And this all underscores the need for transformation, and that's why the NAM launched the Healthy Longevity Global Grand Challenge. So next slide, please. The Global Grand Challenge has two components: a comprehensive policy report called the Global Roadmap for Healthy Longevity that you see on the left side of the slide. And the whole idea is to study the challenges and opportunities presented by global aging and then make recommendations for policy, for changes as a blueprint for society globally. On the right side of the other part of the Grand Challenge is the prize competition, which we're here to talk about. It is to analyze and catalyze bold ideas and to stimulate transformative innovation and build a broad ecosystem of support for healthy longevity. Next slide, please. Now, since I can't see the slide, I'm assuming this next slide is talking about science and what areas of science we're supporting. Because we're at an inflection point where science and technology can transform the way we understand, address aging. And there are various new and cutting-edge opportunities and ways to potentially extend the human health span. So we listed here three. First, by delaying or interrupting the biologic process associated with disease and aging, we may be able to prevent debilitating illness, disease, loss of function, and several areas of promising research demonstrate that biological aging, in fact, is modifiable, and that in some cases, health and lifespan can be extended. Second, using technology, we can also transform the way we age to prevent, detect disease early stages, and improve older adults' quality of life. And third, applying the latest social and behavioral sciences to improve health care for older adults and reduce loneliness, isolation, to name just a few. Next slide, please. So the global competition is to catalyze innovation everywhere that can improve physical, mental, and social health and well-being for people as they age. We're looking for outside-the-box new ideas in disease prevention, molecular pathways, mobility, functionality, social connectedness, urban planning, policy, and other domains. In other words, innovation from any field that would improve, whose research will improve physical, mental, and social health and well-being for people as they age. And I'd like to tell you a few words about the design of the competition itself. Next slide. So the competition is divided into 3 core phases. First, as you can see in the bottom pyramid, is the Catalyst Award. These are given annually. And of course, our idea is to encourage as many innovators as possible by giving seed money. And so they're given $50,000 each, intended to help them begin, execute their ideas. And over the 4 years, at least 450 Catalyst Awards will be given worldwide. And this is modeled after Gates Foundation's Grand Challenge Exploration Awards that the late Tachi Yamada actually initiated. Let me say a word about Dr. Tachi Yamada. He was a good friend. He was a leader. And he's the one who encouraged me to go forward with this initiative, in many ways shaped this competition. We're very sorry to lose him about a month ago, sadly, but he's still with us. And his legacy and his influence, you will see in today's meeting, and of course, in going forward with this competition. Now, what's unique about this application is a 2-page application. We don't need any preliminary data. We judge it on the basis of innovation and how bold and novel the idea is. So from that base of Catalyst Award, capturing as many people as you can in different parts of the world, the second phase up is the Accelerator Award. And these awards will give additional funding for select Catalyst Awardees. It's a realm of 300,000 to $1 million, or even more, as you heard from Home Keller from European Investment Bank. They will be investing in projects that demonstrated proof of concept, including those for potential commercialization. And the third, top of the pyramid, will be the grand prize, which will be prizes up to $5 million or more to the breakthrough achievements of the innovators. Now, you see in the slide the time frame. We have started the Catalyst Award. We're now beginning the second year. And as you'll hear later on, there are more and more people joining from different parts of the world, so it may extend it longer than we intended. The Accelerator Award is just beginning, and of course, grand prize about 5 years from now. Next slide, please. So we've been so lucky because we have these global collaborators, many of whom I'll introduce later on, and together we create a worldwide movement. So as you can see in the slide with map, Catalyst Awards are open to innovators in over 50 countries and territories. And we have the fortune of having 8 and now 10 of these global collaborators who's supporting them. Together, NAM and its global collaborators have mobilized over $30 million for Catalyst phase alone. So we continue to add new collaborators over the years. In 2021, we welcome Chile and the partnership between Chinese University of Hong Kong and University of Hong Kong as new sponsors. Looking forward, Canada is planning to join us, as is others, and adding new regions in the world as well. Last slide, please. Overall, we're very pleased with the success round 1. Received over 1,500 applications worldwide. And together, the NAM and its global collaborators issue 154 Catalyst Awards. You know, winning ideas range widely across virtually all topic areas, from basic biomedical science, clinical medicine, to social science, behavioral science, public health, digital health, engineering, computer, data science, urban planning, policy, and more. And that's why we want to do this. We're so gratified to see the range of interest. Many of the awardees are here with us today at Summit. And later, they share the ideas and progress made over the last year. And I think you'll really enjoy the next 3 days in listening to the innovators, meeting with senior researchers and role models, and having interactions and inspirations throughout the 3 days. So that is, in fact, I'm happy to have my background in terms of this whole idea of the global competition. Now I'd like to transition over to discussion with my good friends, the global collaborators, the leaders and principals from these collaborating organizations. So let's show a slide of the names of the principals and affiliations. This slide shows you the individuals whom I will introduce that will join us in this. They include, of course, as you can see, and I'll introduce them. So why don't I do that? But suffice to say, there are 8 funding organizations here that covers over 50 countries and territories. And as you heard, we're adding more people who have joined us. And they'll be starting in 2021, 2022, and onwards. So I'd like to have this conversation with my colleagues because they funded and administered the award competition, and I just want to get their experience and, of course, their inspirational remarks. So before I introduce all of them, I would say my colleague and collaborator from Agency for Medical Research and Development of Japan, AMED, President Mishima, was unable to join us. But I know many of the AMED awardees are in attendance, and you'll hear from President Mishima on day 3 of Summit when we announce the 2021 Catalyst Awardees. So let me say hello to my good friends, and I hope that what they do is just wave to you when I read the names, and I won't have time to talk about all their great accomplishment. Suffice to say that I was mentioned where they're from. First is President James Liel, the president of Academia Sinica of Taiwan. Jim, are you here?
Hello.
Thank you,
Hi,
Jim.
Victor.
Great to see you.
Good morning, good evening. Good to see you all.
Yes. And we'll come back to you, Jim, very shortly.
Okay,
Dr.
sure.
Chen Wang. Professor
Hi.
Chen Wang, president of the Chinese Academy of Medical Sciences. Chen?
Hi, Victor. Nice to see you and everybody here. It's so nice can join this conference and we can change some ideas about the aging society and the healthy problem about aging. Thank you.
Thank you. Third is Dr. Kurt Holler, Director of Business Creation, the European Innovation Technology Health of the European Union. Kurt? Are we missing Kurt? Let me move on to Professor Chachuan Tan of the Ministry of Health of Singapore. Chachuan.
Hi, Victor. Good day, everybody. So nice to be able to participate in this meeting.
Thank you. And then Dr. George McGuinness, Healthy Aging Challenge Director of the UK Research and Innovation. George.
Hello, everyone. I'm really excited to be part of this and concluding the first really good year of the Global Challenge.
Excellent. Thank you, George. And then last but not the least, Dr. John Phillips, the Chief of Population and Special Processes Branch of the U.S. National Institute of Health, National Institute of Aging. John.
Hi, Victor. Thanks very much for the invitation. I'm looking forward to the discussion. It's been a great year.
Excellent. Now, I wonder if Kurt is now joined us. Okay, let's proceed. First, I'm going to ask you a general question and hope everybody will answer a number of general questions, and then I'll throw the questions out for whoever wants to answer, and then there may be questions coming from the audience. So can all of you just say a word about the situation of the population aging in your country? And what are you doing about this, and particularly what your organization is doing about this? May I start with first Jim Liao? Oh, Kurt. Welcome, Kurt. I just introduced you. Please say hello.
Hello, Victor, and hello, everyone. Sorry for being late due to the time shift. I had a conflict, but thank you so much for inviting me.
Thank you for joining us. So I was just beginning to have a conversation with all of you. And my first question for everyone is, what is the situation of population aging in your country, and what's your organization doing about this? I asked Professor Jim Liao to answer first.
Okay, thank you, Victor. Everyone, good to see you all. As you know, that the whole world is entering into a different phase now, especially after the COVID-19. But even before COVID-19, we know that the society is aging very quickly, particularly in Taiwan. We will be entering a phase where we have more senior people than the rest of the population in as short as 5 years. So this is a very big challenge to both the economy and the social welfare system in Taiwan. So the government here has launched several programs aiming at taking care of the elder person. In our organization, the Academia Sinica, we are a research organization. So we launched several grand challenge projects aiming at studying the diseases, particularly happening in the aging populations. So this coincides with the healthy longevity initiatives that Victor initiated 2 years ago very well. So we participated in this competition, but we broadened our scope by inviting all applicants from Taiwan, not just from Academia Sinica. So they participated in this type of competition. And we follow the general spirit of healthy longevity. That is, we ask for very short proposal and look for innovative ideas only. And the reviews are all double-blinded. So the reviewers don't know who the applicants are. And through that mechanism, we're able to select some very interesting ideas. Some of them may even sound crazy. They've never been able to be funded in a normal academic type of review. So this is a very good experience for us, and also inspired many researchers to look into ideas outside of their normal boxes. So this is an unexpected effect, because most of our researchers are typically looking at the NIH type of proposals where they establish a well-funded hypothesis and move step by step. And with the stimulation of this grand challenge, we push them to think outside of the box and compete with those people who are from industry, in different walks of life, and think about the really big issues in the aging society. So you'll see that, I'm sure in other countries as well, the topics range widely from medically oriented to a lot of social problems. And this is our experience. And we're looking forward to continue this participation in the coming years. Thank you.
Thank you very much, Jim. Really a lot of very exciting activities. And thank you for joining us in this movement. May I turn over to Professor Chen Wang?
Yeah, so, because of in the past several decades in China, we have a family planning plan. So it's the aging issue is coming very, very rapidly in recent years. and the percentage of aging population have reached over 20% in recent years. So we have to face into a very severe aging society issues at this time. So when we join this competition, this campaign, this longevity campaign, we can attract more young investigators to pay attention to the aging issue from the medical view. So it's I think it's very helpful for us for resolve the aging aging problems in China. So thank you.
Thank you very much. Kurt, tell me what the European Union is doing in this space, and particularly encouraging innovation and the ability to translate some innovation to human application.
Thank you, Victor. So indeed, healthy living and active aging, that's actually also the motto and the focus of EIT Health. So when the European Union called for our application for the consortium to be built, they put healthy living and active aging in the middle of it. And that basically already shows and demonstrates that healthy longevity is something that is supported by two things. On the one hand, taking care of chronic diseases, providing solutions for that, getting innovative ideas and approaches, but also prevention. Healthy living is focusing very much on prevention in order to have a healthy longevity. So that's in the end the two perspectives that the European Commission has put on the table when they called for EIT Health and when they called for our initiatives. Now, what are we doing all together? In the end, we focused on innovative ideas by young talents, entrepreneurs that spin out from universities, from academic research projects, but also on a focus of let's say, bold ideas that entrepreneurs might not be able to implement themselves. And both is, I think, very well supported by our joint mission and by having joined the Grand Challenge. EIT Health benefits a lot from this global mission, let's say, and that global perspective.
Thank you. I'll come back and ask other questions about this in a few minutes, but let me turn to my good friend, Chuan Tang. Chuan, I still remember coming to Singapore, and then you and I, over a drink, says we should do this. And of course, I know the Singapore situation, that you have all of the government approach, all the society approach to addressing aging. Tell me what Singapore situation right now, how's COVID affecting this, and then how are you guys moving forward with your agenda?
Thanks, Victor. I think first, it's terrific to see how this whole program has developed so rapidly and so successfully. It's really wonderful to be part of this. Singapore has I call it distinction of being one of the fastest aging societies in the world. By 2030, more than a quarter of Singaporeans will be over 65. So it's a major priority for Singapore. In 2015, the government held a year-long public consultation involving more than 4,000 people across all walks of life and developed a national blueprint called the Action Plan for Successful Aging, and has put aside 3 billion Singapore dollars, that's about $2.5 billion US dollars, to fund 70 initiatives that range from health promotion, education, productive longevity, built environment, mental health, community connectedness, and a variety of other themes. And over the last several years, we have been implementing these different programs, and most of them are well on track. In addition, the government put aside 200 million Singapore dollars to support a special program on national innovation challenges for aging. And we have deployed this research to support specific areas which we felt needed to be strengthened. So, for example, 2 recent grant calls focused on the caregiving ecosystem, how it can be improved. And the most recent grant call is on frailty, its detection, prevention, and mitigation. So I think these fit in really well with the program that we have here, the Global Longevity Challenge, because that adds a very important international and cross-sectoral and cross-disciplinary dimension. Final thing I'd like to say is that the COVID pandemic, of course, has taught us many things about aging. It's reminded us that we previously used to focus largely on non-communicable diseases. It's been a real wake-up call that we also have to pay a lot more attention to infectious diseases, particularly the ones that hit older people, and not to let that slip out of our radar. So thanks very much for this. Look forward to the continuing discussion.
Thank you, Judge Wang. Thank you. Certainly, COVID has shown how vulnerable the older population is. If you look at the statistics, the majority of deaths, and certainly United States, elsewhere, and people over 65. But also it highlighted the whole social and other environmental factors, isolation, loneliness, and of course, mental health. And I know the next person I'm going to ask, George McGinnis, is very interested in this area, particularly in the social aspects of aging research. And George is from UKRI, and I just want him to say a word. George, first of all, the overall context of aging in UK, and then how all this fits.
The overall context is very similar to what you've just heard from other people. And we would also go back to 2015 for the recent sort of rise in interest and policies focused on aging society. And I think I would highlight a couple of things from that. So while there's a lot of biomedical research going on, huge interest in multi-morbidity and things like that, what happened sort of 5 years ago was really thinking about what can we do before people become really old and frail? So focusing on people as they age, and a realization that you can't do this all with publicly funded health and social care. So what can we do to help people live better, healthier lives? And that has certainly been a focus. And I think as we come through the COVID, Victor, I mean, you were talking about most of the deaths in the over 65s. Actually, some demographers tell me that the actual impact on life expectancy, the statistical impact, is actually quite small. So once the crisis recedes, the long-term strategic issue of aging populations is still with us. So what are we doing about that? So my main program, my main focus, and our focus for these awards has been really thinking about the level of societal change needed to adapt to actually the opportunity of aging populations as well as their needs and demands. And so we've been very interested in those sorts of things that will come through in the sort of 10 to 15 year time frame, hence the focus on social and behavioral research, but also on design, urban design, utility design, etc. So all of those sorts of things coming through. And in fact, we've seen that in our awards. We have quite a lot that are led still by science and technology principal investigators, but they've actually taken on board much more of the social sciences in informing their work, as well as having a good bunch of social scientists leading other aspects of the award. So that gives you a flavour of what's going on in the UK.
That's terrific. Thank you very much for highlighting the important aspects of social behavioral sciences, in addition to biomedical engineering sciences. So, NIH is the world's largest biomedical institution with regards to it supporting research. And of course, we're so glad that NIA has joined this whole initiative through a special set of grants. John Phillips is here. John, I mean, you guys are doing a lot on aging. Tell us a little bit more about, first of all, the U.S. situation of aging broadly, and then what you are trying to do in this space.
Thanks very much, Victor. The National Institute on Aging's mission is very well aligned with the objectives of this initiative. As you know, the United States spends more than other countries on health services, but ranks relatively low in life expectancy. Life expectancy in the U.S. has actually been declining overall in the last few years, with some subgroups having had little improvement in life expectancy for decades. Growing SES and regional differences in mortality and life expectancy, as well as persistent racial inequalities, increase the urgency in research-supported approaches for ameliorating the disparities and improving healthy life expectancy in general. Our institute is also spending a significant number of resources on curing and approaches for caring with those with Alzheimer's disease, which naturally is an increasing concern as populations age. The challenge has actually produced an opportunity for us to leverage other investments that we've made in aging research intended to turn discovery into health. I think over the next few days, you're going to hear from a few of those projects. One, for example, just landing to what George was talking about a moment ago, is about health-seeking behaviors and how people's information about various health-seeking behaviors affect their ability to kind of effectively manage various types of diseases that are an issue with aging, so like CVD. So I do think actually that this is in some respects less about kind of our understanding of biology and more about our ability to kind of modify circumstances and health behaviors for the purposes of improving healthy life expectancy. So I think a lot of the projects that we've been doing are about just that. So hopefully these will, despite some of the challenges that we've faced from COVID that have kind of created issues with some of the projects that we've launched. We're hoping to have some of these things move forward to the next stage of the competition.
Thank you very much. That's really helpful. You know, one of my slides I showed say that there are these three areas of research. Of course, it's a lot more that I think we like to emphasize. But where we think the major impacts are, one is biomedical research. Second is the whole area of digital technology. And third is the social behavioral sciences and the issue of equity. And I think many of you covered all three, in particular the latter one. Let me just spend a minute with all of you, think about the frontiers of biomedical sciences. There's so much excitement these days. I still remember the early days where there's really, I would say, good quality, but not sufficient. But now there are breakthrough areas, such as partial reprogramming, epigenetics, the biologic clock, and many others. I wonder if the panel would like to say a word about how they see this field going and what kind of research are they supporting in their country and their domain in terms of promising research in the biomedical field. Chen Wang?
I think we have organized many young investigators being involved in this research competition, and more attention has been attracted to this research works. In the pandemic of COVID-19 in recent 2 years, and I think it's have a very significant influence on the drawing of this competition. But in recent several months, more and more investigators have been involved in this competition, and I think the situation in China. Thank you.
Thank you. Jim, in the project you supported, and I'll come to the engineering digital science next, but what about biomedical science? Are you seeing anything that's promising in this field?
Yes, definitely. I think the most promising aspect is indeed the combination of the biomedical science and the novel IT technologies. Okay, it lies in the interface between the two, in the life sciences and electronics, instrumentation, and computer science, AI, machine learning. especially that all the excitement coming from the AI field, coupled with the AR, all these visual technologies that will fundamentally transform the biomedical research from the molecular level to the behavior level. And this is a major advance in biomedical science. Okay, previously, as you know, biomedical science are always a reductionist approach. People look at the disease from a molecular standpoint. While that is very fruitful, but the next phase will have to link those molecules to the human behavior. And there, I think the advances in IT technology, in machine learning, in AI will play a crucial role. And you'll see that particularly in the study of aging diseases, for example, the neurological diseases in Alzheimer's, in Parkinson, in dementia, all that kind of diseases, all calls for this interdisciplinary research. And I think that will be the major challenge and all major opportunities coming forward.
Thank you. That's really, really helpful. Just thinking out loud about this interface, and importantly, the idea of bringing digital technology innovations to patients' home. Chuan, I think in Singapore, you are having smart homes, you're having remote monitoring and many technologies. Can you say a word about where you are and how do you see the potential of this technology to be helpful to the older population in the everyday world?
Certainly, Victor, maybe if I can just make 3 quick points. First, George mentioned that prevention is so important, and I just wanted to mention a kind of counterintuitive program that we are emphasizing in the next 5 years in Singapore, and that is maternal and child health, trying to work during the antenatal period and in the early childhood development period to see whether we can optimize development, try to change the trajectory of long-term metabolic and other illnesses starting from very young. So we are building off a very well phenotyped mother-child pair kind of cohort that has been established a few decades ago. So I just mentioned that. Another area I mentioned is we are indeed looking very much at digital enablement of the elderly, both in terms of the living environment and also making them fit more easily into a very fast-paced urban life. This includes finding ways in which we can unobtrusively put remote sensors in people's homes, respecting their privacy, but allowing them and the caregivers to monitor their conditions and to link with their caregivers. And this example of this is really the humanized AI approaches that are being developed by a couple of our universities in Singapore. The third thing I'll just mention on the digital side is we're also very interested in digital phenotyping, which Jim mentioned. In particular, digital phenotyping to understand better if we can develop more objective markers of mental health, progression of mental illness or deterioration, so that we are better able to reach out, provide self-help to help people to do self-help types of interventions on mental health issues, and also allowing them to connect better to human providers, whether counselors, psychologists, or the formal healthcare system. This is still very early. We think it holds significant promise, and it's an area that we are working on the research side as well as in deployment pilots to assess its benefits as well as its acceptability.
Yeah, all of you have emphasized the excitement in science and the breadth of possibilities. Maybe to John and George, this whole concept of geoscience is emerging. I hear NIH talking about this, UK talking about this. Can you give me an idea where you think the field of neuroscience, what is this, and what do you see it in the future? John, can I start with you?
Sure. This is something that would likely be better described by my biology counterparts, but I would say that this idea of hallmarks of aging, measuring hallmarks of aging, like you had mentioned earlier, the clock, and doing so in a multidisciplinary frame is something that we're trying to do among many things in this area. So to make an example, we support a number of large population representative studies in multiple countries based on the Health and Retirement Study, which is about a 20,000 person longitudinal panel study that's multidisciplinary. So it collects information about social and behavioral factors, healthcare data, but also gets biodata that allows you to do genetics and other types of things. And to the point that George made earlier, kind of really put together the idea of the biological aging and how it's associated with social and behavioral factors as well as biological ones. I think that that's a fantastic basis for thinking about both biological change as well as how the social environment and behaviors can actually be modified for the purposes of improving health and longevity.
Yeah. George, your thoughts?
So very much sort of reflecting what John said, I think one of the things that in the last 18 months has really come through as a strength in the UK has been the digital infrastructure that's been in place and able to look at populations and gather real-world evidence, in this case on COVID therapies and their effectiveness, but the ability to look at things and get very rapid evidence to be there is actually based on years and years of investment. Colleague of mine is running a program called Accelerating Detection of Disease, looking to generate a biobank cohort of 5 million people linked to their primary care physician medical records, which are all electronic in the UK, etc. So those digital tools are there and the real world evidence is there. Or emerging. I think one of the things that's quite interesting, and go back to what Xiaoshan was saying about putting technology in the home, I think for us there's an awful lot of solutions out there, but they're not yet really configured as services that solve a real world problem with people, and that's, I think, where a lot of our focus is not, is using modern technology, but actually going beyond that and really saying, well, what are the business models, what are the services around that technology that are really needed to make a difference in people's lives? So I've given you a picture, sort of two ends of it. One's a very biomedical end of what's going on, and the other is more of that sort of social and behavioral piece.
Well, isn't that true? I mean, that's why I meant about the neuroscience. It's getting to be an area emerging, very exciting, that covers a whole span of sciences. Is what we would call convergence, if you will, all focus on the same issue, right? And this leads me to ask Kurt the question, because EIT is very interested in supporting these kind of discoveries, research innovations that can move into human application through commercialization. I guess the correct question is, when you have a great idea and you begin to test it out, and you want to really move it towards broader application, obviously, you need a pathway forward. Kurt, can you say a word about what EIT is doing?
Sure. So actually, also our grand challenge helps a bit to understand what we do in general. So we you could see that we had a pretty specific call, but it still showed that we had applications coming from different areas, from digital health, biotech, medtech. So there was lots of diagnostics, decision support tools, remote monitoring and home care, wearables and medical devices, and treatment. And from that, the topic of prevention, diagnostics and decision support was the most prominent one. And what we do is we help startups or entrepreneurs that have that great idea from the beginning to indeed validate their idea, and not only in their home market. So people tend to just sit in their cluster in their region and ask their local medical doctors. But of course, there is a lot of value in getting feedback from top university hospitals in other European countries to see how things are implemented there. Then, as a next step, we put them in touch with corporates, with industry representatives that have a lot of knowledge and insight on how regulatory and how reimbursement works. So that's kind of the big landscape. Now, looking into details to get first insights and first results on how things work out, how first ideas that scientists usually have in their lab, how that applies to the users, to the patients, to the people. Of course, we connect people and connect institutions to then form and have the first outcomes. So living labs and test beds that focus on both real applications, but as well as digital topics. I think that's a very strong and powerful tool.
Yeah, Kurt, is it true that you're particularly interested in projects that may already be in early stage formation of companies that sees a pathway going forward, not so much for the profit issue, but the pathway of being able to move it to, broad scale application through commercialization?
Right. So it's totally right that our focus is on things that can already be brought into the market. So we also have a section of innovation projects, but when we talk about the impact of services and products, then indeed it's much better from our perspective if things are already proven, if investors already provide the right money in order to scale and in order to bring the product to the patients. Because as all of you know, regulatory and reimbursement is something that just takes time. COVID has taught us that even clinical studies in that certain case could be done very, very quickly. But in regular cases, it all takes time. And in order to have impact, in order to demonstrate impact, of course, we want to focus on already well-established also business cases. It's not, in order to have impact, you also have to prove and provide a valid business model. That's right.
Yeah. So you hear later on that the next level called Accelerator. And what we're trying to do is to bring together funders who's interested in helping the innovators to move the concept to further along with the proof of concept and to possibly commercialization. You hear, as you heard earlier, that Johnson & Johnson Innovation is going to fund a number of awards, Accelerator awards, up to $750,000 to provide support for individuals to move towards this idea of commercialization. You heard from Home Keller that the European Investment Bank is now looking at some of the innovators and selecting possibly those to also provide a lot more support. So I think this pathway of moving from concept to reality, we have to help people create a pathway, and that's what kind of work you're doing and others are doing as well.
Exactly.
Yeah. Okay, so let me spend the rest of the time maybe specific on the Catalyst Award. And, this is open to anyone. And maybe the first question is, why did you decide to join the global competition? What were you hoping to accomplish? And has your goal been realized through this competition? What's your experience so far? And, anyone can say, I know that people are, waiting, but if anybody want to put their hands up, please do so. But if not, I'll just pick on some of you. Anyone? Yes, George.
So firstly, I think the Global Longevity Grand Challenge was absolutely aligned to where our policy was going. So it was a really, really good opportunity. And I think for me, really attractive to be working quite closely with a whole range of other countries with other opportunities and to connect our Catalyst Award holders internationally. And I suppose if I have a frustration, it's that we're meeting virtually today, that COVID is still preventing some of that international dialogue that I think is so important to actually carrying this mission on.
Yeah. So, Jim, what were your thoughts when I first approached you about joining this? I mean, you obviously were very clear and decisive in supporting us. But what were your thoughts about what you hope to accomplish? And has the experience of this first year enabled you to say, yes, I think it looks promising? You are muted.
Okay, let me start by saying, yes, it's promising. And I also wanted to share a thought that scientists are like athletes. Athletes are looking forward to Olympics every 4 years. And scientists, they need an opportunity to build their camaraderie. And this healthy longevity stimulates their thoughts, as well as giving them an opportunity to share their ideas or to compete for something that they think is worthwhile. So this is a very nice avenue to stimulate people who work very hard in the lab trying to create something that are useful. And they want that to be known to other people and to help the world. So I think this is a very good way to stimulate the new ideas for scientists.
Chen, were you pleased with the type of the quality of application, the number of applications, or were you expecting something differently?
So Victor, first I would say that, if I may, there are a number of very attractive features about the global challenge. But I'll just mention one, which is that researchers in Singapore get to be connected and belong to a community and a network of global researchers who span so many different fields, span so many different sectors, and in the future we include entrepreneurs, funders, etc. That is quite unique. And it's really important, I think, if we want to have fresh ideas and to have fresh thinking in addressing common and different problems across the world, that we have that community. So I would say that is particularly attractive, I think, for a small country like Singapore. I am happy with the way it's evolving. In the first grant call that we had, it was largely biomedical science programs, a lot of neuroscience, a lot of basic science. But then in this second call, I was glad we saw a much wider range of people and disciplines applying. We saw a lot more social sciences, digital sciences, data scientists. So I see that as a really good sign. And it's a really good platform, I think, to encourage people to think that they too can participate in research in longevity and to be given opportunity to join a larger community. So I expect that further grant calls are going to stimulate additional interest from sectors that in the past would not think that they ought to be involved in healthy longevity. And I see that that is a very good thing, particularly if you consider how they can connect with like-minded but diverse parts of the global research community.
Thanks. John, I think that NIH, NIA had a slightly different approach to this. And you, in fact, give out grants that provided international work as well. Can you say a word about that?
Yeah, thank you. Our program actually called for projects both in the United States and in other countries, in particular low and middle income countries, to kind of apply innovative approaches to improve healthy longevity and in some respects also improve function. And we got 7 pilots that we ended up getting awarded. And we used a pilot grant mechanism, which is basically a 2-year level of support for folks to kind of initiate a topic on a specific area that met the RFA. I think that actually is not a bad model for doing this. And we actually got projects that ranged from, projects that were looking at dealing with social isolation of the elderly in the United States through smart sensoring and speakers, as well as things trying to mitigate improve fall reduction, and projects as well in Africa and other places. So we get a wide array of projects. I think if there's one thing that I would say we'd like to do differently, there'd be 2. One, of course, is it would be great if we were able to do these projects without the pandemic interfering with them. I don't think that was something we could have done about that. But the second, I think, is you mentioned at the beginning when you were talking about how the typical Catalyst award process went, that they were like 2-page, kind of give me a high level idea, and if it's exciting, we'll kind of let you go forward. We kind of imposed the NIH review structure on this, which put a lot more requirement up front for people to be able to provide preliminary data and so forth. And I do think to some degree that will stifle some types of research ideas. So I think, down the road, should we do something like this again, I think we might consider a different type of a model to simulate a broader array of project topics. Having said that, I think we actually got a few that could be really useful, and I'm hopeful that they'll be able to move on to the next phase of the competition.
Thank you. Perfect segue to our next question, which is the way that this competition is designed, at least that we designed it for all our collaborators, is that it's small amount of money, $50,000, and bold ideas. George, do you think that the $50,000 is too modest? I mean, are people saying that that's good, that's enough to get us going? Or it's not, as John said, the traditional grant, which is more than 1 year, more than $1 money. But here we're saying bold ideas. We just want to get you going. We don't need any preliminary data. George, how successful is this in your point of view?
So in some ways, Victor, it's a great question because we've learnt from our Wave 1 recruitment experience and built those changes into Wave 2, and we've seen a step change increase in the number of people interested in applying. And we'll be announcing later this week a significant increase in the number of awards as well. So £50,000 or dollars even, so we're using pounds, so it's a little bit more than the $50,000, but has been sufficient to attract people. But on the basis that actually they're not required to put forward all the normal rigmarole of research applications right at the beginning. So we've used a staged process where people learn about the scheme, people learn how to apply, and only get to the formal thing pretty much at the point where they know they're going to be successful. And so making that application process easy has actually been really important for us for opening up the diversity, not just of the individuals, but also in terms of the topics which those individuals want to take forward. So we think it's been a pretty good. The next question is, where's the next funding coming from? And again, I think the conversation will go on to that. But that's the important thing, that people feel that by the end of their $50,000 year, there is somewhere to go. And I think our people have that confidence.
Oh, that's good. Perfect segue to a question that we as sponsors are happy. What about the awardees? What are you hearing from them? Are they getting something out of this? Again, is this enough support? Does it help them get going? Jim, what are you hearing?
Unfortunately, we don't have that information, but my sense is that the award is on the low side. So I think we should consider increasing the award size a little bit, particularly for those who are focusing on the biomedical research. So things are getting more and more expensive, as you know, every year.
Yes, that's right. So I think that we begin discussions, certainly with new sponsors and new foundations, about the idea of either increasing the amount or actually giving 2 years. We still would have the accelerator, but the idea would be that maybe from this experience, we need to give a little bit more, or that we need to give a little longer support. I'm not sure yet, but I would be interested in hearing your reaction. Chuan, what are you hearing?
Yeah, I think same comments. I think for some types of research, $50,000 is more than enough. For a lot of research, it's not. And so one idea might be to have an increase up to, so you don't have to give the full amount of a larger quantum, but you could if it merits it. And I think everyone's also very interested in follow-on funding. So I think this is seed funding that gets your idea going, but it is probably inadequate to move it much further. And to take it further, the quick follow-on funding is really important. And I think that's where between this program and the national research funding programs, I think we'll have to find ways to provide that additional ways of quick seed follow-on funding.
Yeah, I think that's a very important point, Chuan, because the global competition, this one here, is just to mainly mean to get things going, get a global movement, get people more excited. There has to be national programs or other funding support to continue this potential and promising research, right? And so maybe that's why a good question is, what are your countries doing in addition to the global challenge of making sure that many of these good ideas are supported? Kurt, any idea what EC is doing, or EU?
Thank you, Victor. That's a very good point. That in the end, the motivation, the mobilization of good ideas, of support to entrepreneurs, is coming through joining forces. So I think that the visibility that we give them, the movement that we start and that we kick off through our grand challenge is certainly visible. And I just want to remember and remind everyone, we had 400 applications in our first wave, so that was really, really impressive. I think it was super attractive to our entrepreneurs to be part of it. At the same time, we referred to that, we want to usually support companies that are already a bit further mature, so that have at least registered the company and that have a product that can be brought to the market. And there, the discrepancy is actually pretty broad. So we can see that in the northern countries, there is lots of programs to startups at that maturity level. And winners from our competition had an easy time to get follow-on funding, for example, in Germany, in France, in Scandinavia, on top of the funding that we provide. So in the end, the 50K was not so much the money that they needed in order to take the next steps. It was the proof for other funding organizations to just provide follow-on investments. For the southern countries, and let's have a look, for example, to Spain, there the 50K really made a difference. So for them, it was really urgently needed money to take the first steps and to prove a valid business plan. There, of course, is also national accelerator programs or incubators, but not to the extent that we see in the northern areas. Overall, I would say it's the right combination to provide some triggers, to provide some seal of excellences, let's say, so that national programs then can take over.
Yeah, those are really excellent comments from all of you with regards to what could be next. So in thinking about down the road, if you will, you have all committed for 3 years. And, I set the number 50,000 because I didn't want to come across as too greedy from all of you. I want to be sure that you are willing to put the money to support. But what are your ideas? I mean, first of all, we have new countries joining us. So Chile, Hong Kong, Canada, we're speaking to, so we've reached South America, more Asia. We're trying to reach Australia and New Zealand and other, Latin American countries. And we need Africa, obviously, although to some extent, Kurt, you covered parts of Africa. We'd like to see this continue. Give me your perspective. Are you prepared to think about expanding or extending this support to make sure that momentum continues? As you said, Kurt, you have 300, 400 applications. I know UK had a record increase. All told last year, we have 1,500. So if you multiply that by, let's say, 5 years, that's 7,500 or even 10,000. So we are beginning to have a broad network, if you will, right? So can I ask your reaction? I'm not asking for commitment. Whether we should think, okay, at the end of 3 years, we're going to stop this, or it's worthwhile continuing. And then through this conversations called global collaborators, start modifying. As Chuan said, you can, each country can be a little different, as NIH is already a little different. So then you can say under the same umbrella, we can give up to, or we want to do this. I'm totally open to the idea of really trying to get more innovation going. So thoughts?
Yeah, I think it would be a pity to lose that momentum that he gained altogether. And even having that group, so now everyone is a bit more familiar to each other. So aligning a bit on how we could proceed, how we could increase the money that we provide to our companies. Of course, everyone has to think about how many can we afford in the end, how much do we want to give maximum. I think it's also okay to have regional differences, but having that joint collaboration and keeping that momentum is super important.
Yeah. Yeah. So some thoughts? Chen Wang had to leave, so that's why his video is not live. So I'm turning to mainly most of you. George, any thoughts?
So we're actually just going through a budgeting process. So we're very keen to maintain the momentum on this. As I said, we learned a lot from moving from wave 1 to wave 2, and we hope to continue that learning process. I think, given that this is a global grand challenge, 3 years is too short to actually have an impact long term. So they're very, very, very keen to see this continue.
Yeah, I see Chuan also shaking his head in agreement.
Yeah, indeed, Victor. I think from Singapore's side, we'll be keen and very happy to continue support beyond 2022. Yeah. And also happy to work with you and everyone else to see what improvements, modifications, enhancements could be made to the program. But we'll be happy to support it further beyond 2022.
Thank you very much. Jim, you said that we're not getting enough money. What are you thinking about?
Well, I think, first of all, I totally agree that we should keep the momentum. But I think in the next 3 years, we need to try to put out Healthy Longevity 2.0, try to modify our program in some way that suit the different countries to include more talents. For example, we probably can tap into the elderly people for innovation. So far, we focus on young people for innovation, but it's the elderly people who know what they need. And many of them are still very energetic and innovative. Okay, so that is a variation of the theme that we should look into that.
Thank you. We have not put an age limit in the application. I just think that we inclined to think that the entrepreneurs, innovators are younger. But actually, let me correct you. There's a few applications, successful applications, which are generally people over 65. And in fact, in looking at this year's number, there's one person over 80 that made it to the finals. Yeah. So, some people are still active. Well, speaking for myself, I'm definitely ready to apply.
We should probably have a special category for the people over the 65 or something.
Yeah, you got it. So let me, the time is running out. Let me just have each one of you say last word. Very quick round, maybe starting with John Phillips first. John?
Yeah, so first I'd just say thank you, Victor, and for everyone for having us be a part of this. It's actually been really interesting. I think that I want to echo one thing that everyone said, that kind of continuing the momentum on this is important. NIH, has many grant programs that people can apply to, but I think that a thing that was really appealing to applicants to this process was this notion that once they had a successful pilot, there was a natural connection that was going to keep the thing going forward and move towards some kind of meaningful implementation. And I think that's really an important thing and hopefully something that can be continued.
Thank you. Kurt?
Thank you, Victor, for having that very initial bold idea and having turned it into a really great outcome. Thanks to you and your whole team. And actually, one of my visions would be to also have at some point of time a roadshow of all the regional and national winners, because it would be so amazing if we would be able to represent the winners of all different continents in each of the continents, so that we also link all our global activities really physically together. And in the end, also our innovators and companies need that global access to other markets, so we could prepare them early on through our network that we have established in the last two years.
Thank you. Jim?
Yes, I'd like to thank you and congratulate you on this initiative, and has been getting a very good start, and we look forward to continuing this collaboration and looking forward to Healthy Longevity 2.0.
Thank you, Jim. Healthy Longevity 2.0, I like that. George?
No, I'll just echo a lot of what's already been said. I mean, I think you provided a stimulus for us to do something that might not have been done in exactly this way. I'll maybe contradict Jim a little bit. So one of the things that we're really excited about this year is seeing more early career stage researchers come forward. We expect them to work with older people to develop their solutions, but trying to get younger researchers interested in getting impact from their research is, I think, a really important part of going forward.
Thank you. And Chuan?
Well, it's just been wonderful to see a terrific idea become reality. And as Jim says, I think we've made a really good start. I do feel we should build further on the momentum and see how we can adapt along the way, so that we can develop the community, the networks, and also the crossflow of ideas and thinking that I think will help all of us do a better job at figuring out how we can best promote healthy longevity in our own countries. So congrats and thanks very much, Victor.
Well, let me thank all of you. I think it's clear that aging will be a significant issue that we all have to deal with. If not, already we're dealing with it. And having this initiative to address it through innovation is a very important direction. And thank all of you for your great commitment. And Jim, I will take you on your word. We're going to start working with all of you to think about Healthy Longevity 2.0. So thank you again, and hope to see you at the rest of the meeting. Bye-bye.
Bye-bye.
Thanks.